Many Triad students, they're headed back to school today, along with new teachers, classmates, routines, all of this, as well as questions about helping our kids stay physically and emotionally healthy throughout the school year. So joining me today, we've got two guests from Cone Health, Pediatrician Zainab Qayumi, and she is from the Cone Health Premier Pediatrics of Eden, and psychologist Dr. Jenna Mendelsohn from Cone Health LeBauer Behavioral Medicine. So we're going to kind of just talk about how we can have a successful start to the school year. And we want folks at home to know, you know what, you get to ask questions as well. We're going to ask our own questions, but we want to make sure that we get your questions answered. So you see the number that's at the bottom of your screen. That's 336-379-5775. You can text in your question, and we'll get to that a little bit later on. All right, first off, let's start with this. School has officially started, but there are some big adjustments that kids face during the first couple of weeks back to school.
Yes, actually there's a lot of different adjustments that can occur. The biggest one being waking up early. In the summer, they've just been relaxing, waking up whenever they want, but when the school year starts, they need to start waking up at an assigned time, which can be really difficult.
So I'm sure this morning was a tough morning.
Oh, yes.
Because they were like, really? Is this the first day we're getting up? Okay.
Yep.
So speaking of that, it's normal for the kids, right, to experience some nervousness on the first day of school. Not only are they tired, but they're nervous, right, Dr. Mendelsohn? So how can parents tell the difference this week of the typical back to school jitters versus I might need some more additional support?
Yeah, good question, because yes, back to school jitters can be completely normal and even healthy, and children may experience a range of emotions with the major transition that is the return to school. But some signs of a problem could be if your child demonstrates a significant change in their mood or behavioral presentation that persists beyond those first few days or weeks. So that could be changes in mood or appetite, seeming nervous, but also maybe seeming angry or irritable or just kind of down and withdrawn. A child avoiding school or seeming to lose interest in activities that they used to enjoy. And I would add too, if your child has debilitating changes in behavior or emotion, so a child who is so anxious, they're throwing up, they can't keep food down, or a child who is so scared to go to school, you have to carry them into the building, those children may actually need additional support before a few weeks have gone by.
Yeah, and you're saying that, and there's some parents at home who are going, oh my gosh, could it get that bad? And it can get that bad, and yet at the same time, there are ways to help with that.
Yes.
Which is what we really want the parents to know is we're setting up the worst case scenarios, but also telling you that there's help there.
Absolutely.
So today, I know we kind of talked about their sleep schedule, and today was the first, like, oh my gosh, it's not summer anymore.
Yep.
How do we know, like, weeks on end if our kid just isn't getting enough sleep?
Oh yes, just kind of similar to what you said already is if they're irritable, having trouble concentrating and learning in the classroom, and of course falling asleep if they fall asleep on the school bus or in the classroom, then we know they're not getting enough sleep. Kind of a rule of thumb that I always tell my parents when they come in the office is our younger kids, 9 to 12 hours of sleep a night, our older teenagers, 8 to 10 hours a night.
That's a big bulk of time, because as adults, we do not get that kind of sleep, right?
Exactly, but we also want to make sure they're waking up and going to sleep at similar times.
And we need to work on that specifically this week, I'm sure.
Oh, sure, definitely.
All right, so Dr. Mendelsohn, if a child comes home after the first few days of school and they don't want to go back, now you talked about some like really intense scenarios, but what if the kid is just like, I just don't want to go to school?
Yeah.
How do you respond to that as a parent? Because the first thing that wants to come out of our mouth is, that's your job, you're going to go.
Absolutely. That's not something any parent wants to hear after the first day of school. So a key first step to remember is trying to manage our own emotional response to hearing that enough that our children will feel comfortable to open up about why they might feel that way. Trying to maintain a neutral, calm demeanor as much as you can. Avoid jumping to problem solving right away. A lot of kids actually can get a lot out of just talking through a situation. And if we go straight to problem solving, we miss that opportunity. And also avoiding saying things like, oh, you're fine, or it's no big deal. That all might be true, and it might make us feel better, but it actually can land as pretty dismissive to our kids, or might make them feel crazy for feeling how they do.
When do we get to switch to the fixing? Because I get it, what you're saying, don't fix all the time and don't just, pass it off.
Yeah.
But at some point there needs to be a fix, right? But not in the initial part.
Right, absolutely. First we want to help our children through the difficult emotional experience where they might not even really be in a mental space where they are going to do a great job fixing it. But after they've had a chance to talk, then we might ask like, all right, like, do you want some help thinking about next steps here, or encouraging them to start thinking about that.
All right. And as kids are returning to class and they got all those extracurricular activities, let's talk about what some families can do to reduce the spread of common illnesses.
Oh, of
Don't
course.
you know, those kids get into class and
The
it's like
first
a
week,
petri dish.
the first week, yes,
Yes.
of course. Well, a lot of kids already know this, but it's good to remind them. Washing their hands with soap and water for more than 20 seconds, or using hand sanitizer when water's not available. Kids are already aware of this because they talk about it in the classroom, but covering their mouth when they cough or
Right,
sneeze.
in their
in their
elbow.
elbow. They're actually very good about it. Both my boys do that all the time. And of course, staying up to date with their routine vaccines. The other ways to prevent illness is eating healthy, sleeping well, and making sure they're drinking plenty of water.
Which is hard for all of us, right? And then we have to like make sure our kids are doing it.
Yep, exactly.
A little bit of nagging, right? Just
Yes.
a little bit.
Just a little bit.
Coming
But it's
from
better
another
from them
parent,
getting
right?
sick. Yes.
All right, we're going to continue our back to school discussion. We'll be back in just a few minutes.